Hello, and welcome to this episode of Health Matters, a health program brought to you by the Farmington Valley Health District. My name is Jennifer Kurtanis, Director of the Farmington Valley Health District, and your host for this episode. As your local health department, we work hard to ensure the community conditions in which people can be healthy and thrive. Our recently released Community Health Improvement Plan, or CHIP, is the blueprint that outlines our priorities based on health data and recognizing that we are living longer and the proportion of our population living over the age of 60 is growing, optimal well-being for older adults is one of our 4 priorities. Today, we'll be discussing volunteering and community engagement as one strategy towards our goal of optimal health and well-being for older adults. You might be wondering, what does volunteering have to do with health? Well, there's quite a bit of research and literature on the topic, and I am pleased to be joined by Colleen Van Hemert and Dave Boudreau to explore the value and benefits of volunteering and engaging. Welcome to you both. Thank you for being here.
Thank you, Jennifer.
So let's just start by each of you telling us a little bit about yourselves. Dave, we can start with you.
Okay. Hi, I'm Dave Boudreau. I live in Granby. I moved here from Maine, but I'm a Massachusetts native. I retired from the refrigeration air conditioning business, and I'm currently a volunteer with the Farmington Valley Health District, teaching a class called A Matter of Balance.
Great, thank you. And Colleen?
Yes, well, I'm Colleen Van Hemert, and you can hear from my accent, I'm an Australian, so I'm a newbie to America. I've been here for 3 years, and the magic number for me was hitting 80. That was the opportunity for me to come over here and live with my daughter and family, which has been a wonderful experience, a big move. I have adjusted fairly quickly thanks to volunteering.
Wonderful. Well, we're going to explore that a little bit more. I can imagine that, relocating from across the world, you're looking for ways in which you can kind of acclimate to a new community, to get involved. So tell us a little bit about how you first got involved with volunteering once you got here, because you had family, but there was a lot you still had to learn about the community.
Absolutely true. Well, fortunately, Jennifer, I had done a lot of volunteering in Australia before I left. So I already knew how important being out in the community is after you've retired. So when I came here, it was fantastic that I had a daughter who encouraged me to get involved as quickly as possible in searching for things to do, and volunteering was high on the list. That's how I became involved in taking the Matter of Balance course. And following the Matter of Balance course, Dave and I were both in the same class as students, and we were offered the opportunity to take the coaching course, which we then did, and the rest is history. We've been out teaching, I think we're up to about our 18th class so far.
Wonderful.
And it's been a very, very helpful thing to do.
Yeah, it certainly has been a benefit to the health district, and I'll talk about that in a moment. But Dave, before we go there, tell us a little bit about how and why you got involved with volunteering.
Well, I had recently retired. I was looking for things to do. I had also recently fallen, slipping on some black ice, and one of the things that my local senior center was offering was a fall prevention class. So I took that class and liked it, and afterwards they were offering a training class for coaching that class, and that seemed like serendipity, that I was looking for things to do and enjoyed the class, so I became the coach for the class.
Yeah, that's wonderful. So we'll talk a little bit more about, the benefits to the individual volunteering, but I know from the health district perspective, having volunteers really expands our reach. We're able to offer more programming through lay leaders like yourselves. As you mentioned, the two of you alone have done approximately 18 different programs, each with a reach of anywhere from 15 to 20 individuals. It also, I think, provides a way for lay people such as yourselves to get a better understanding about the work that the health district does, and to kind of be ambassadors for the Farmington Valley Health District. So I know those are the benefits, some of the benefits that the health district has experienced, and I'm sure that's true for other organizations that provide volunteer opportunities. So, I think you've each touched on this a little bit, but what would you say most encouraged you to get involved? And I know, Colleen, you talked about your daughter really encouraging you right away to kind of immerse yourself in some type of engagement. But were there personal motivations that you had or things that you were looking to get out of the volunteer experience, especially having volunteered in Australia?
I think, Jennifer, having had a teaching background, I've taught in state schools, private schools, in the commercial world as well for many, many years. It was a perfect fit for me to do something that involved teaching skills for a start, so using the skills purposefully. But also I recognised how important it was to have a purpose and a goal, something that, kept me focused and up and about every morning and out there into the community. It didn't take long to start to make those kind of connections. And also knowing that I'm doing something that really fits with my passion for helping people to gain some agency over whatever is happening in their lives, particularly being a senior myself. I guess we teach what we need to learn, and it was easy enough for me to want to do that.
Oh, that's a beautiful statement, right? I mean, you're trained to impart a certain amount of information, self-empowerment, that sort of thing, but what you receive in return, is also really powerful. Dave, how about you? What do you think encouraged you to get involved with volunteering?
Again, it was something to do, but after taking the class, the thing you see most is the community and the socialization in the class, that everybody sees that they're not in this alone. We all share the same problems as we age, and it's the sense of togetherness really. I'd see it more and more every class. It's just great.
Yeah, that's wonderful. So, in my introduction, I really talked about, what's the connection between volunteering and health? But there's been a lot of research that specifically talks about the impact on mental health. And you guys have identified the fact that it gave you a sense of purpose. I mean, oftentimes you hear people retire and after dedicating their entire lives to a career, and that sense of purpose that they got from their employment goes away or diminishes. Connecting to individuals. I mean, sometimes retiring can be isolating. You don't have the same social support network that maybe you did through a workplace. And all of these things have connected back. And then having a positive influence on someone else's life, right? What can be more rewarding and positive for your own mental well-being, that knowing that you're contributing in that way? Yeah. Can you tell us about your specific volunteer opportunities? Because you do volunteer for the Farmington Valley Health District. I mean, Colleen, you've spoken about that. Dave, you've got some other volunteer experience as well.
I volunteer for the Farmington Valley YMCA as well. That's just a little bit of giving back all that I get from the Y. It's a wonderful place. That's kind of informal at this point. I'm undergoing a background check and stuff because you work with kids and stuff there, so they're a little more strict about who they have as official volunteers. But I'm in the process there. But I've been volunteering there informally for a couple of years now. So
right. And you both have mentioned this matter of balance. So for the Farmington Valley Health District, one of the things that you support us in is your lay leaders for this program called Matter of Balance. So the title kind of describes a little bit. But Colleen, can you start by telling us a little bit about what the Matter of Balance program is?
Absolutely. Well, it's an 8-week course, and the thing that I love about it is that it's a holistic approach to preventing falls in the elderly. The thing that I love most about it is that it covers not just the physical, the exercise component, which of course is important for strengthening muscles and so on and so forth. But the other part that I love is the behavioural side, which encompasses so much about ageing per se, being able to have a look at some of the habits that we have relied on all our lives, which haven't caused us any problems until we start having a fall, and all of a sudden, you know, life can turn on a dime if you've had a nasty fall. And I think the people that come to us have either been referred by their primary care physicians or a member of family to find ways in which they can prevent falls in the future by strengthening. The amazing thing that happens is that in the classes that we conduct, which are very, very collaborative discussions, that people share with us some of their fears, and we're able to help unpack those fears, challenge them in all kinds of different ways to see how real they are, and find ways to practically do the same things but with a different outcome, more safely in other words. Mm-hmm. And it's so incredibly satisfying to see that change in perspective happen around about week 4 when the class goes through the process. Yes. Yeah.
And you mentioned it's an 8-week course.
It
so
is.
This volunteering for you is truly a commitment. It's once a week for 8 weeks. It's a few hours for the class. And then I know that you both do preparation just to make sure you're prepared. Neither one of you, I mean, you had some teaching experience, but neither one of you really had public health experience. Dave, tell us a little bit about, I would imagine for volunteers often there's probably this concern of, you know, do I have the subject matter expertise? Am I going to be able to do this? Tell the audience a little bit about what preparation you had, and did it prepare you sufficiently that you felt comfortable offering this program as a lay leader?
Well, we do, it was a 2-day training, so you get adequate training. Plus, we had also gone through, Colleen and I both took the course as students, so we were pretty well versed as to what the course was all about. And then you get adequate training. You've got plenty of people to call on that have taught the course and so forth. So, you know, there's plenty of resources available to answer any questions you might have. And that's going to be the case with any volunteering you do. You're not going to be thrown into the deep end and good luck. And, you know, you're going to be able to ask questions and get the answers you need and be comfortable doing it. So.
Yeah, I think that that's a really good point, that an organization that, you know, uses volunteers for different areas is going to make sure that the volunteers have the resources and feel comfortable doing whatever is asked of them. So let's have fun with, tell us about your favorite part of, you know, getting involved in doing your volunteer activities.
The classes we deal with, we meet so many amazing people dealing with truly life-changing circumstances that they are working really hard to overcome. So it puts your petty problems in a whole different perspective, and it gives you a different outlook on life. I go into those classes, whatever mood I'm in going in, I come out of those classes in a good mood because I feel inspired by the people in those classes. It's just truly amazing that the people we deal with. So it's just great.
Yeah. And I mean, again, that's something that is really positive for your own, you know, mental health and well-being.
And the fact that we've been doing it for a while now, so that we see the data, we see the results, we know the class works. So, you know, we're seeing that we're really helping people too. So it makes you feel good because you're actually doing something. So.
Right. Yeah. And Colleen, any other favorite parts?
I agree with everything that Dave said because we both share that experience. The shift in perspective doesn't just happen with the class as they learn all of the fine points of matter of balance, but it's our shift in perspective too that we get to see the enormous benefit it is when you get a group of contemporary people together who are comfortable with each other in a trusting environment where they feel comfortable to talk about some of their most diabolical fears openly and honestly. It's very, very humbling, and I think we as custodians of that knowledge, we take that very much to heart.
Sure.
And it brings us joy to help them.
It's, in a day and age where isolation is, really growing, yes, you're trained to focus on the matter of balance curriculum, but the community, the sense of community and connectivity that you're describing is important regardless of what that topic is.
To me, become the biggest part of the class.
Yeah,
absolutely.
That's great. And I would imagine that another wonderful offshoot of this is that members of the class probably connect among themselves and then develop long-lasting connections far beyond the 8 weeks.
We see that all the time, yes.
Do you have a
inspiring.
personal experience with that, Dave?
Well, I've made a great friend through the class.
Yeah.
I also actually met my girlfriend through the class. So, it's been very beneficial for me personally. So.
Yeah. And I think that I know some of our other lay leaders have, run into smaller groups of the class, like at the coffee spot or something, because they continue to get together and, a really important, sometimes it's hard as an individual to step out and find those social connections. But when you get out there through this type of a class, find the social connection, it's built, and then you can grow it beyond, which is really valuable.
We actually have quite a number of frequent flyers who come back and do the course again, which is wonderful because they bring back, extra knowledge that they can share, which helps the newbies in the class realise just how effective the program is.
Right. Are there any unexpected, we've covered a lot of ground in terms of the benefits that and the rewards that you feel having volunteered, but are there any other unexpected outcomes or benefits from your volunteering experience?
Well, as Colleen mentioned, the class involves exercise. It's not strictly an exercise class. There's a lot of other aspects to it, but it does involve exercise. So it's actually motivated me to exercise regularly, which is
That's
new
wonderful.
to me. So that's been a very unexpected benefit. It's been life-changing for me.
That's wonderful.
Well, probably the unexpected benefit, which shouldn't surprise me, is the networking information that we get from being in our classes. Being new to the country, as we said earlier, it can be quite destabilising, not knowing this, that and everything else. But being in a group of people who know their own country and are just so warm and welcoming and helpful, I get lots and lots of hints about, where you can go, where's a good plumber, where's a good hairdresser, blah, blah, blah.
Yeah.
So that little networking thing.
That's
is
wonderful.
Very supportive.
Yeah. And they want to help too.
Yes.
So
Yes.
they
Yes.
get that benefit.
Yes.
Yeah. That's wonderful.
Yeah, we learn as much from the classes as they learn from us.
Always.
Definitely.
Yeah,
Yes.
that's wonderful. Yeah. Do you have any suggestions for people who might be on the fence about getting involved or may not know how to find volunteer opportunities? Colleen, you were fortunate in that you had a family member here that, really kind of could help guide the way and link you in with programs. Dave, you talked about taking the class and then learning about the, lay leader opportunity. But there's probably lots of people out there that are on the fence, may not know how to start. What advice might you give them?
Well, probably the easiest places to start are places like your local food bank, community kitchen, even the local, if your town has a volunteer fire department or the volunteer Ambulance Association, because those places are probably always looking for help. And most towns have them, so the opportunities are there. As far as finding out about them, like the food banks, community kitchens, places that collect the food for them, whether it's the senior centers or local supermarkets. So you'll be able to find out where those places are readily enough, and you probably already know where the fire department and the ambulance places are. And you don't have to be a firefighter or an EMT. They're always looking for help answering phones, clerical stuff. So there's plenty of opportunities for that. And those kind of places, likely you would be working with your friends and neighbors. So it would be people you know and you'd be comfortable with. And getting one opportunity to volunteer somewhere might expand out to other opportunities that pop up. So that's the low-hanging fruit. That's the easiest places to find opportunities, I think.
I think in a previous conversation, we talked about, outlining what are the things that you enjoy or are passionate about, or, maybe you enjoy sports, maybe you like working with kids, maybe you don't want to do anything with the teaching, that's not a comfort level, but kind of mapping out what your volunteering goals or interests are is an important first step too,
I would say
right?
so, yes.
Yeah, and there are different places to adapt that. Some towns are part of a project called urcommunitycares.org. It's UR, the letters UR. And that's a volunteer organization where you actually register with them, and then you give them your interests, and then they try and match the volunteer opportunities to your interests. So it's a nice setup that way. But also, there's so many opportunities to volunteer out there that you're bound to find something that matches your own interests.
I think, another little thing that we can add to that is things that you love absolutely and that you're good at, crafts, cooking, whatever. But there's a lot of research to say that cognitive health is greatly aided by jumping into something that you actually might find a challenge, because that will stretch you that little bit further. Sure. So for anybody out there who feels edgy about doing volunteering but wants to have a go, the best thing to do is to get out and do it, because you'll get the kind of support that you and Dave have talked about from the organisations with whom you'll volunteer, but also you will stretch your own imagination and keep you mentally and cognitively much healthier as well as physically.
Yeah. I know at the health district, we have a number of volunteers. Some, are very interested in more clerical administrative support. They may come to the office and have the social engagement with the staff and the team, but aren't really interested or comfortable dealing with the general public or teaching a class. We have others that are exceptional writers that, we can, support some of our newsletter related activities or write articles on different things. So I think the message in this is that there is a volunteer opportunity for everyone that's interested.
Whatever your interest or abilities, yes, for sure.
So Dave, you mentioned the urcommunitycares.org. Where are some other places that people can go if they're interested in volunteering?
The urcommunitycares.org is a nice setup, but unfortunately it's involved with certain towns, and not all the towns in the state are currently involved with it. They're expanding, but so far they're not everywhere. If you just Google volunteer opportunities Connecticut, you get surprisingly decent focused hits. But if I were to just pick one place to look, it would be the 211 website. So hopefully everybody knows about the 211 Essential Community Services phone number. If you need help with meals or lodging or even suicide prevention, that's a great phone number to call. But their website is 211ct.org. And if you go to that website and then search there for volunteer opportunities, you'll get Connecticut opportunities, but you can put in your zip code and it will give specific opportunities for that area. And I just did that just for Granby, for example, and it came up with a good 10 different ones, the food bank and community kitchen that I mentioned, but also the Y, and half a dozen other ones that I wouldn't have ever even known about. And you're bound to find something that would fit your interests and abilities just in your local area. So it's a great resource.
So as we wrap up here, any last words of wisdom regarding volunteering in general or encouragement for people to get out there and do it?
Well, it's like the Nike ad, just do it.
I was about to say the same thing, Dave.
You won't regret it. You'll feel great doing it, and you'll feel great for having done it, and you're helping everyone involved. So
Absolutely.
Wonderful.
Couldn't agree more.
Well, on that positive note, I just want to thank both of you very much, not only for being here with me today to share your experiences and hopefully encourage others to volunteer, but also for the incredible work that you're doing with the Farmington Valley Health District.
it's totally my pleasure. Yes.
Wonderful. Well, thank you. To find volunteer opportunities, we encourage you to visit 211ct.org. And to find out more about the Farmington Valley Health District and the Community Health Improvement Plan, you can visit our website at fvhd.org. Thank you for watching. And until next time, remember, your health is your greatest wealth.
For over 40 years, SCM has been the voice of our town,
bringing us together through local programming,
education,
and live broadcasts.
SEM isn't just about television.
It's about empowering our community,
ensuring our voices are heard during government meetings,
and celebrating milestones
like our high school graduations.
But today, SEM faces a challenge.
Our funding structure is based on television subscriptions.
And it's no secret, people have been cutting the cord.
With a shift to internet-only subscriptions,
SCM receives less revenue,
even though all our programming is freely available online.
We need your support.
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 Your donation can make a difference.
It will ensure that SCM remains open,
continues to educate our youth,
and keeps our community informed.
Thanks to SCM, I've been honing my creative skills, helping me work towards my college degree.
SCM is crucial for keeping our community connected.
SCM isn't just here to broadcast local events. They're actually preserving Simsbury's history.
Join us.
Join us in preserving Simsbury's voice.
Simsbury's voice.
Together we can ensure that SCM continues to thrive
for generations to come.
Visit our website
or scan the QR code on your screen to make your donation.
Every contribution
counts.
Thank you for supporting Simsbury Community Media,
where your town,
Your schools,
and your government come together.